Hello, I'm Sue Jubin with Multisport Madness, and today we're here in St. Charles, Illinois at Advanced Physical Medicine. I'm here with Dave Williamson, Doctor of Chiropractic and Sports Medicine. Dave, tell us a little bit about what Advanced Physical Medicine has to offer.
Well, we've been in St. Charles for 10 years. We focus on chiropractic rehabilitation, orthopedic rehabilitation, sports medicine. We are fully staffed with chiropractic physicians, massage therapists, physical therapists. We do personal training. We even have pain management specialists come in to consult our patients, as well as psychologists and podiatrists, trying to bring a full service type of service to our patients with the multiple needs that they have. Over the past 5 years, after becoming affiliated with Multisport Madness, we were really drawn towards the sports population. We made a lot of changes over the past few years to kind of enhance our treatment and bring better quality service and more innovative services to the patient population that we do have.
So, as a Multisport Madness member, or as a triathlete or an athlete in general, what do you have to offer here for our members?
Well, we like to say our services are tailor-made to what your needs are. If you're recovering from an injury, obviously you're on the rehabilitation side of our facility, focusing with physical therapy, chiropractic care, massage, but even for our athletes who are wanting just to stay healthy or improve their performance, working with our personal trainers, using our AlterG for improving their speed with their runs, working with podiatrists to actually work with orthotics. You name it, we can hopefully offer most of the services in our office, depending on what your needs are. So the key thing to do is almost come in with what your goals are, and we spit out what we can provide for you.
Okay. I know a lot of our members have come and they've used the AlterG for, I think people have used it both for rehab and also for improving their skill level, trying to get faster, improving their cadence per se on running. Can you tell us a little bit more about the AlterG?
Yes. Initially when I researched the AlterG, it was mainly to keep my injured athletes running. People were suffering from stress fractures, a back injury, having to go through a knee surgery. Any type of break in their training was going to affect their performance. So after doing some research, I found that the AlterG would be great into keeping them moving while they rehab and enabling them to not take too many steps backwards as they were progressing through their training. But in that, I found that a lot of my healthy athletes are now starting to use it, and we're finding that the ability to actually retrain the body to run faster, more efficiently, has been very effective in the AlterG, because we can actually control their environment. We can work with cadence drills, we can work with different speed drills, we can really make the body a much more efficient machine by using the AlterG as its tool to retrain the nervous system.
Okay. Could you talk a little bit about, I know there's some alternative methods that when people are rehabbing, I think in the past people have used water running or something of that nature. Right. What's the difference between using water running and the AlterG?
Well, the similarity is that they both can help control your weight and weight bearing. Water obviously helps take the stress off the joints, as does the AlterG. AlterG, we can get a little bit more specific as to how much we take off you. Anywhere from 100% weight bearing then to 20% weight bearing. Wow. And anywhere in between in 1% increments. Okay. Water is not the same. Obviously, when you go in the water, you're going to be losing a consistent amount of weight with your use of that. The problem with water is the resistance that it creates when you're running through it. So it's not really a natural stride or a natural gait pattern, because we're going against the resistance of water. Someone starting out, a new runner that has been battling with, maybe shin splints or knee pain with running, we can actually get their body used to running by tolerance testing them as they go through their initial runs, and eventually get them to 100% weight bearing and out on the road doing their job. Higher level athlete training for Boston Marathon. Mm-hmm. We'll put them in the machine for an hour to simulate that last part of their run. We'll have them run 45 minutes at 70% weight bearing, and then the last 15, put them at 100%, they feel like it's mile 22. So their body has the effect like, oh my gosh, my legs are so heavy.
Right.
I gotta push hard. And we really make them feel that. So when they are at Boston or at Chicago, they know in their head, I can keep going even though my body's saying stop. This machine does a lot more than we thought.
Yeah.
You know, I'm a doctor, so I love the orthopedic side of this, but I also am an athlete, and no athletes like to push themselves. This is a way to push yourself in a healthy way. We're not 20 anymore, most of us,
Right.
so we can actually push the body in a healthy way instead of the pounding that we put on our legs all the time with our running.
If I'm a member, an athlete, and I want to take advantage of AlterG here at Advanced Physical Medicine, how do I go about doing that?
Simply call the office, let them know. We set up a consult with one of us, just to make sure you know how to use the actual machine the first couple of times to be comfortable with it. You can buy either a 30-minute punch card, a 45, or an hour, and just use it intermittently. Some patients own all three. And it depends what their workout is that day. If it's a recovery run, 30 minutes, they're on there. You know, it's a building run for the marathon, they might do an hour. Some actually do, like I said, up to 2 hours worth, depending on what they do. There's information that has been provided in the past that I will also provide that gives really good discounts to the Multisport members.
Okay.
That they can utilize that, especially when they're training for those marathons and their Ironman triathlons. This is a great machine for that day after that 100-mile bike ride when your legs are killing you. Work out some of that tightness, work out some of that pain on this when you can unload the body, go for a nice run, feel good afterwards, but also get an effective workout in and not miss a day because you're too sore.
Right.